The following segment is sponsored by BioMarin Pharmaceutical Incorporated. A new gene therapy has provided a new option for managing a rare blood disorder. Dr. Singleton is here to educate others about severe hemophilia A and raise awareness of its symptoms. Welcome to the show, Doctor. It's great to see you.
It is a pleasure to be here, Kari.
Now, what is severe hemophilia A?
Absolutely. So severe hemophilia A is an inherited or genetic condition where there is the absence of a protein called factor VIII protein that is critical and very much so needed to have normal blood clotting.
Okay, now what does a typical patient treatment journey look like?
Absolutely. So because patients who have the absence of factor VIII have significant bleeding at the joint spaces that can be debilitating, like ankles, knees, or elbows. They can also have severe life-threatening hemorrhages into a brain, body cavity, or airway space. Because it can be either debilitating or life-threatening, patients need to replace the factor VIII that's missing. They can only do that through an intravenous or IV infusion. It's typically done at home. It can be done in emergency rooms or hospitals across the country. And patients usually infuse on a daily basis, 3 times a week, every other day, to prevent bleeding episodes. They also have to infuse with any trauma or surgical procedures in addition to that regular cadence or frequency of infusions to prevent bleeding.
Okay, and how does gene therapy for severe hemophilia A work?
Absolutely. So gene therapy is a little different because gene therapy is a single one-time IV infusion that is approved for patients who are 18 years of age or older living with severe hemophilia A, and that really replaces the functional gene that's missing. Once you replace that functional gene that's missing in that single one-time IV infusion, that functional gene then has an opportunity to secrete the factor VIII protein that's missing in a more continuous and kind of steady way into the bloodstream to facilitate normal blood clotting. So that can potentially take away the need to have those very frequent IV infusions to prevent bleeding episodes in patients who receive gene therapy.
Wow, interesting. Okay, what benefits can gene therapy have on the lives of adults with severe hemophilia A?
Well, for patients who are 18 years of age and older living with severe hemophilia A, there's an approved gene therapy option or product. It's called Roctavian. This Roctavian, again, is that single one-time IV infusion. And because it's a single one-time IV infusion replacing the gene that's missing, again, it can potentially allow patients to have the opportunity to have the availability of the factor VIII protein that's missing in a more steady and constant way, eliminating some of those very frequent and burdensome infusions that patients often have to use to prevent bleeding episodes.
Wow, okay, thank you so much for all of this information. Where can we go to learn more?
Absolutely. So patients living with severe hemophilia A can go to their hemophilia treatment center, talk to their hematologist, or go to roctavian.com, ROCTAVIAN.com.
Thank you for joining us today, Dr. Singleton. Have a wonderful day.
Thanks, Kari. Same to you.